We obviously also need to develop guidelines for long-term follow-up. Again, the pediatric community is well ahead of us. They have evidence-based guidelines that they developed out of the Children's Oncology Group that are posted. They're very complicated, but they are out there, and they are basically best practices because these numbers are so small in here, it's hard to get a real evidence base. We're only just working on that. I know ASCO has a committee looking at this, and when they reviewed the cardiac toxicities, they could come to no agreement about that. So it tells us we nearly need to develop the evidence base there. And then, as I said before, looking at models for care and how we're going to do this, and maybe looking at how people do chronic care, because as we think of cancer more as a chronic disease management models may become important. And finally, we have to be listening to our survivors, because they are the individuals who are informing us all the time of where we're falling down or not meeting their needs or need to be more concerned about issues that they are facing. So this is, I know in my own research, has driven most of what I've done, is listening to survivors say, I'm tired all the time, or I have no desire to be intimate with my husband, or I can't remember a thing. These have really been driving a lot of the critical questions in the research. And finally, if we're really going to be successful in this, we've got to change the culture of research and care. So basically, and I think this happens actually more often than not in the community cancer centers than anywhere else, is recognizing that the patient is as important, and perhaps sometimes more important than the tumor, is getting back to that basic model.